So you'd like to learn more about sleep apnea and specifically the dental alternative therapies to sleep apnea. Most people are familiar with a continuous positive airway pressure machine called the CPAP. I'm here today to explain more about the dental alternative. It's called oral appliance therapy. I'm J.C. Goodwin. I'm a dentist. I've practiced over 26 years in the Prescott area. I have a diplomat credential in dental sleep medicine, one of only a handful of people in Arizona that have that credential. I work a lot with sleep apnea management for people who just can't tolerate their breathing machines. And that's what we're here today to talk about. Sleep apnea, by definition, means that a person stops breathing while they're asleep for a period of at least 10 seconds. 10 seconds doesn't sound like very long. It's 3 normal breath cycles, and if you stop breathing for that long a period of time while you're asleep, your oxygen level in your bloodstream can drop by several percentages, which drives up the heart rate and the blood pressure and ultimately increases your risk for a heart attack and stroke dramatically. So sleep apnea is a very significant, serious medical condition. It was only identified in the early 80s, the 1980s, before anybody really recognized what the syndrome was and how severe the consequences are. Sleep apnea is also associated with excessive daytime fatigue and increased risk for traffic accidents and fatalities relative to traffic deaths. It's associated also with depression issues, with chronic pain issues, chronic headache, bruxism or grinding of the teeth, acid reflux disease, high blood pressure, difficulty controlling diabetes or blood sugar control issues, and just a host of significant medical problems. So it's much more than just snoring, and people need to recognize the fact that some people make a lot of noise while they sleep. That's a social issue, and they may not necessarily have apnea. However, if you snore heavily, you have 50% odds that you actually have some degree of sleep apnea. Sleep apnea is also not necessarily associated with people who are overweight. That's the classic stereotype, is that you have to be a 50 or 60-year-old overweight man and smoke 2 packs of cigarettes a day to have sleep apnea. That's not true. Teenagers, young children can have apnea. Easily more than 50% of the people that I treat aren't overweight. They're normal-sized people. So certainly increased weight does carry increased risk of having apnea, but apnea is not a disease of heavy people necessarily. So how would you know if you have sleep apnea? We ask screening questions in our office to try to help determine this, but the primary thing is if you snore heavily, odds are nearly 50% that you have sleep apnea. If anyone has ever told you they heard you stop breathing while you're asleep, especially when you were snoring heavily and you stopped breathing, you have sleep apnea. It's not a matter of it. Did you know that people with unmanaged apnea are 4 times more likely to have a heart attack? They're twice as likely to die in their sleep. They're 7 times more likely to have a motor vehicle accident, 2 to 3 times more likely to have a stroke. You're at significantly greater risk for diabetes, depression, impotence, and other health issues. Sleep apnea, if not managed properly, can reduce life expectancy by 10 to 20 years. Can you fall asleep easily? Do you stay asleep? Do you awaken feeling refreshed in the morning or feeling chronically fatigued like you never really went to sleep? Do you have frequent headaches in the mornings? Do you grind your teeth? Do you have migraine headaches? Have you ever awakened in the night gasping or choking for breath? All of those are very highly correlated with sleep apnea. The dental alternative to therapy, or oral appliance therapy, has a greater than 90% compliance rate and can be more than 90% effective at managing your apnea. So what happens if you have sleep apnea? You know you've been diagnosed with the condition, you've tried your CPAP machine and you can't use it. What do? That's where I get involved. We do what's called oral appliance therapy. Most commonly, we do something called mandibular advancement, or use a mandibular advancement splint. You don't have to remember those words. That's a lot of words to talk about. But this is what it looks like. Let me show you an example. There are many different varieties. There are dozens of different brands out there, some that you can even buy on the internet. I don't recommend it. But basically, they almost always have a device that fits on the upper teeth. There's something that fits on the lower teeth. They look somewhat like orthodontic retainers. They're relatively small, relatively thin. They all have in common that they have some kind of mechanism to be able to push your jaw slightly forward. You can see in this particular device, right here is a wedge assembly, which if as you close the two pieces together, would gently slide your lower jaw forward, like that. So you can see relatively small, comfortable, easy to work with, easy to adjust. Those are the key elements whenever we're looking for a successful mandibular advancement splint. So it can be relatively simple. So if you're one of the people who's already been diagnosed with sleep apnea, you know you have a condition. If you're wearing your CPAP machine and you have severe sleep apnea, stay on your machine. It's the best thing for your health. If you have had a diagnosis of mild or moderate apnea or severe apnea and you can't wear your machine, perfectly okay to use these oral devices that we make. Now, what if you haven't been diagnosed? What if you think you might have a problem but you're not sure? For everyone who knows they have sleep apnea, statistics say maybe as many as 20 of you have it and don't know it. Come in and talk to us. That's what we're here for. No charge consultation. Just come in and meet us. I'll tell you all about the process. Now, we have some very simple screening tests that we can help you with. Simply a computerized device that's a portable sleep monitor. You wear it at home. You don't even have to go to the sleep lab at this point. Very small device like this straps around your chest. A couple of other small bands that go around your chest. There's a pulse oximeter that's going to tape on one of your fingers like this. Small cannula under the nose. Simple as that. It's called a portable sleep monitor. Won't make a diagnosis, but it's a very effective screening tool to help us understand whether or not you may have a problem that you're not aware of. Apnea therapy is often covered by medical insurance. If you have medical insurance that covers your CPAP machine, very likely you have insurance that'll cover your oral appliance therapy also. We're happy to talk with you, happy to talk with your insurance company and help you get that information. So in closing, I'm J.C. Goodwin. I've created the Sleep Effect Center for Apnea Management to help people just like you. We'd love to help you. Please give us a call. Phone number is 928-778-4555. That's 778-4555. Look forward to helping you in the future. Thank you.